So my name is Lorraine and I'm a nurse in the UK. I had the mini gastric sleeve. I've been sort of struggling with my weight for quite a while, gone through all the diet clubs and diet drinks and everything, and nothing was really seeming to work. So I thought about surgery, and then when I found out about the gastric sleeve, that sounded like a really good option. When I looked in the UK, it wasn't financially feasible for me at all. There was no way that I was ever going to be able to afford it. But I knew somebody here who had it done, so they were able to give me a bit of information about what it's like having it abroad. The main reason why I picked him was recommendation. It came highly recommended from somebody else who had the same procedure. It was brilliant. I saw him in the clinic the day before and spoke to him. Then I was able to ask any questions. We went through the procedure, went through everything. Then again, I saw him before my operation, and he greeted me in the theatre, and then I saw him afterwards, and I've seen him again today. So yeah, so really good sort of follow-up, really consistent, because often sometimes you don't necessarily see the same people, but no, it's been really, really good. Airport welcome was brilliant. The airport's quite confusing. I wouldn't have been able to navigate it, but there was someone who picked us up as soon as we walked into the terminal off the plane, and they just helped us all the way through. We didn't have to worry about anything. I looked in the UK first, and there didn't seem to be an option. It was just the one type of procedure with you end up with 5 kind of entry ports. So here there were a couple of different options for me to think over, and discussing them with the doctors, it seemed that the mini sleeve would be better in terms of healing, because the instruments are very small and there's fewer sites than there would have been. So it just seemed that it would be sort of quicker recovery, less disruption, possibly any less pain afterwards. So it just seemed like the better option really all round. At the clinic, I saw the nutritionist. I had measurements taken, such as my weight and body fat and things like that, and had a discussion with her around the results of that, and then talked through the diet plan for the next few weeks and beyond. The hospital is very modern, it's very clean, there's very big spacious rooms that are very nice. All the equipment that I was aware of being used, such as to check my vital signs and things, that was all things I was very familiar with. It was all modern equipment, similar to what I use in the UK. Yeah, the quality of the care has been excellent. The staff to patient ratio seems really good, so there's always somebody there allocated to you, and they come in and there's checks frequently. The nurses came in quite frequently, told me what they needed to do, and they all seemed very skilled at what they were doing. I've got the doctor's numbers, which is bizarre for somebody in the UK to have a doctor's number. So we can message sort of any time. It's quite handy to use WhatsApp, because you can just do voice message or type if you want to. So that's good. And then there's online follow-ups as well that are a bit more formal, but it's just so that the WhatsApp's really good, because you can just, any quick questions and stuff, and you've just always got access. I've got a very clear plan, so in terms of dietary and then with medication as well, it's very clear and precise. I had a few questions which were able to be answered. I'm very confident that everything's gone well, and as long as I do what I need to do, I think it's going to be a good success.
جراحات السمنة غيرت ناس كتير، انت كمان ممكن تتغير. وزن أقل، حياة أفضل.